actually causes hypertension?
Yeah, so hypertension has now become an epidemic in India. I know right now we are all concentrated on COVID, but hypertension is actually endemic and it's become an epidemic in India. Almost 30% of people in India have 30% of adults in India have hypertension. Now, first, what causes hypertension? I think it's also for the viewers to make them understand what is hypertension. Okay. So hypertension is the blood pressure of is your blood pressure. And when your blood pressure is elevated, it is known as hypertension. Blood pressure is the pressure at which your body receives blood. Okay. So your heart beats, it ejects blood into the aorta, which is the main vessel of the heart. And then the blood is distributed to the entire body, to your brain, to your eyes, to your nose, to your mouth. All over every cell of your body gets blood. So the pressure at which that blood goes is called blood pressure. You check it with a blood pressure machine. It gives you two numbers, a higher number and a lower number. And if either of those two numbers are elevated, it is known as hypertension. Coming back to your question of what causes hypertension, there are many reasons why people have high blood pressure. The most common reason is you can divide them in two ways. One is genetic causes. So if there is somebody in your family who's got high blood pressure, your first degree relative, maybe your father, mother, your uncle, your aunt, your grandparents, then you have some genes that can increase your risk of high blood pressure. Then there are various other conditions because of which high blood pressure comes up: thyroid diseases, endocrine diseases. Like if you have, you can have steroid abnormalities in your body. You can have it because of kidney problems. If you have renal failure, you have a higher risk of hypertension. You can have it because of what we are seeing a lot of now today is because of diet and lifestyle related issues. The stress, lack of sleep, obesity, bad food, high salt intake. So a person may have one of them or a combination of these causes that causes high blood pressure.
Does smoking and alcohol also aggravate the situation?
Absolutely. So smoking is definitely a very important risk factor for hypertension. They say that after you smoke, your blood pressure remains elevated for a period of time, and chronic intake of nicotine, chronic intake of tar that you get from smoking can increase your blood pressure. Alcohol also has an increased risk of hypertension. This is not in solitude. I mean, it's not just one drink is going to cause your blood pressure, but if you consistently have increased amount of alcohol over a prolonged period of time, yes, it can increase your blood pressure.
Now, for a long time, 120/80 was the golden rule for BP readings. Then in 2007, the American Heart Association, the American College of Cardiology, revised the guidelines after 14 years to 130/80. Now in 2022, there are reports that 140/90 is also fine. So what's your take on this globally and with specific reference to the Indian population?
Yeah, so so I think it's important to understand how we got these numbers. Okay, so 120/80 is your baseline, is your goal blood pressure. The closer we are to 120, the better it is for us. That does not mean that if you're at 110, you have to increase the blood pressure to 120. Some people live at 110, very good for them. That's ideal, right? So 120/80 is where we have to be. If you're at 110 without any blood pressure medicines, if you're at 105 without any blood pressure medicines, Mr. Shankar, a lot of people come to me and say, Dr. Gupta, my blood pressure runs low. Mera BP kam rehta hai. Especially these young women, college girls, they say, I have low blood pressure, my blood pressure is 100. So that's not to be worried about. If you're not dizzy, lightheaded, that's not to be worried about. Young people can live at a low blood pressure. So there was this very big trial. It was called the SPRINT trial. And what they did was they said, so let me add one more thing. So 120/80 is where we have to live. The closer we are, the better it is. The definition of hypertension was 140/90. So between 120 to 140 was kind of the pre-hypertensive / gray zone. And if you're above 140, the top number, 90, the bottom number, then you're diagnosed as hypertension. That is what we practiced for many, many years. So then they came along this trial in 2017 called the Sprint trial, and they questioned the dogma. They said, is 140 over 90 is what we call hypertension. But what if you go down to 130 and the bottom number of 80? What if we try and achieve that number with medicines? So if you are on medicines and your blood pressure is 135 or 138, what if I get it closer to 130? Am I going to derive significant benefit? And the answer was yes. So that means the closer once again you get to 120 over 80, the better it is. It kind of reaffirmed our diagnosis, reaffirmed what we already knew. But it was important for us. This was a very important trial because it really changed the way we thought about treating blood pressure. So now in most patients, we try and reach a goal of at least 130 over 80 because that 10 millimeters that we were missing was giving us incremental benefit in reducing mortality, making you feel better, and more importantly, making you live longer.